Hi everyone, I am Jahn Denver Espejo from Far Eastern University, your student nurse for today. And for today, I am going to perform the surgical hand washing. The purpose of surgical hand washing technique is to help prevent possibility of contamination of the operative wound by bacteria on the hands and arms. Another purpose is to remove soils, debris, natural skin oils, hand lotion, and transient microorganisms from the hands and forearms of the sterile members. It also helps to decrease the number of resident microorganisms on skin to an irreducible minimum. It also helps to keep the microorganisms to minimum during the surgical procedure by suppression of growth. And lastly, it helps to reduce the hazard of microbial contamination of the surgical wound by skin flora. And now, let's proceed to the demonstration. For the attitude, displays proper grooming and wears complete well-pressed uniform. Observes proper decorum at all times. Accepts constructive criticism and handles mannequin or patient with care and respect. And now, let us proceed to the procedure. Turns the tap on to regulate the flow and temperature of the water. Pre-tears the package containing brush. Lay the brush on the back of the scrub sink. Wets hands and arms for an initial pre-scrub wash. Use about 5 ml or 1 pump of surgical detergent. Work up a heavy lather up to 3 inches above the elbow for 30 seconds. Rinse hands and arms thoroughly. Allow the water to run from the elbows to the hands. Remove the sterile brush and nail stick. Moisten the brush and work up a lather. Soap fingertips and clean the spaces under the fingernails of both hands using the nail stick under running water for 15 seconds. In all, then discard the nail stick. Lathers fingertips with sponge side of the brush. Using bristle side of brush, scrub the spaces under the fingernails of one hand 30 circular strokes or 15 seconds each hand using straight strokes going away from you. Lathers digits. Scrubs 20 strokes on all 4 sides of each finger for 1 minute, beginning with the thumb or little finger of one hand. Scrub one hand and arm completely before moving onto the other hand and arm. Use straight strokes going away from you. Lathers palm, back of hand, heel of hand, and spaces between the thumb and index finger. Scrubs 20 circular strokes on each surface. Ready to scrub the forearm. Divides arm in 3 inches increments. Use the sponge side of the brush lengthwise to apply soap around wrist. Scrubs 5 circular strokes on each of the 4 sides. Moves up the forearm, lather, then scrubs up to 2 inches above the elbow. Runs brush under the water and add soap anytime. Repeat steps 6 to 9 for the other arm, then discards the brush. rinses hands and arms without retracing nor contaminating. Turns off tap. Then allow the water to drip from the elbow before entering the operating room. And now we are done with the surgical hand washing method. Thank you.